COVID-19 patients with learning disabilities in the UK have been given do not resuscitate notices. A National Health Service report shows that COVID-19 was responsible for 65% of deaths of people with learning disabilities. That is 6 times higher than the general population. An urgent investigation is underway. Joining us now from Rome is Cristina Gangemi, director of the Kairos Forum for Cognitively and Intellectually Disabled People. She has also collaborated with Vatican Events. Cristina, welcome. Thank you so much for joining us today. Tell us, why do you think the Do Not Resuscitate notice, why do you think it was given to COVID patients with disabilities in the UK?
Unfortunately, in the UK, we have something like 35,000 people with disabilities dead due to COVID. The Do Not Resuscitate is actually something that's been on many people's records anyway, but I think that it was put as a blanket instruction because they feared that there wouldn't be enough beds, and also because it's difficult for some of the national health providers to get consent. The best thing to do, they felt, I think, was just to say, do not resuscitate and do not waste time even trying to get consent. I think that this is something that's more worrying even now with regards to vaccines, because people with intellectual disabilities are not being called up for vaccines, and also because of this lack of capacity, they're not being tested either. So I think it leaves the person with intellectual disability very vulnerable, but I think that that was the reason. It was for fear of having to give up beds for those who are strong, presumed strong. So I think it's a presumption.
Yeah. And in your line of work, Cristina, what are the challenges that you face in protecting people with disabilities?
The challenges are making sure that people with disabilities aren't left to isolation, experiences of isolation and loneliness. This is in the church as well. Even during the pandemic, when the church went online, very little was made available for people with intellectual disabilities. And so I think one of the challenges is that people take people with disabilities seriously, not seeing that they're people to be included, but that they are people who belong to the church, and protecting their lives is just about making sure that they're present and not forgotten.
And Cristina, we probably have about a minute left, but I'm wondering, before I let you go, is there anything about this DNR order in the UK that you think that people should know that maybe they're not aware of?
I think it's important that we, as MenCap did, and as some of my colleagues have done, I think it's important that we don't overlook the fact that people with disabilities have been treated very poorly during COVID. And I think the most important message comes from a colleague of mine, because she says the experience of COVID will invite us to really reflect upon what we value in the world and who we value. And I think that that's very important for us as a church as well.
Oh, Cristina, thank you so much, and thank you for what you do. We appreciate you coming on. Cristina Gangemi, director of the Kairos Forum for Cognitively and Intellectually Disabled People. Thank you again.
Thank you.